We have with us Dr. Paul Sinclair, and I would use this opportunity to give the floor to him to share his views as president of FIP.
Thank you, Rajendra. Firstly, I'd just say thank you for the opportunity, but I'm quite intimidated by the calibre of the presentations we've had, the gathering of significant intellect and expertise. And I think the comment was made earlier that if we could just bring all that knowledge together, then we'd solve a lot of the problems that face us. But the topic today about borders, and in terms of pharmacy, I've practiced pharmacy for the past 35 years, and the practice of pharmacy today is significantly different to what it was 35 years ago, because a lot of the traditional barriers and boundaries have broken down. The pharmacists now practice in different settings within the same community. They practice in nursing homes, in pharmacies, in doctor surgeries, and these are all boundaries that traditionally restricted practice. So that the notion of song boundaries applies very much to pharmacists. As we heard Pamela say earlier, nurses and pharmacists, we talk about access to health, yet they are the most accessible primary healthcare providers. And the challenge for health, which can be facilitated by digital enablement, is to leverage that accessibility and to better exploit the expertise that resides within cadres like the pharmacists and the nurses. At FIP we have a technology advisory group which is focused on looking to promote digital health through pharmacy. We have a digital summit on August 30 this year at our annual congress in Copenhagen. That is oversubscribed every year because the focus and the importance of digital health is increasing exponentially. And I think one of the challenges is that the changes are happening so quickly. We've heard of AI today, and until a couple of years ago you wouldn't have thought of AI as digital health, but AI now permeates everything we do. And the challenge of incorporating and collaborating those two disciplines to get better outcomes. There is, I think, a much greater emphasis on interprofessional collaboration. Again, that's about breaking down boundaries, so that, and that is enabled and facilitated by digital enablement. It's something that pharmacy historically has adopted to very quickly. We've been early adopters of technology in our practice, and certainly I think the opportunities going forward for pharmacy and health outcomes are enormous, and they will be facilitated by digital enablement. The only other thing I'd say is that 4 million pharmacists FIP represents worldwide. That's pharmacists who are scientists, educators and practitioners. And at the moment we are going through a restructure of our organisation to break down internal barriers because each one of those disciplines affects every other one. And you can't have quality practitioners without the influence of education and science. And all of that now is facilitated by digital enablement. So I think it's very challenging times. I see a great future for younger pharmacists, and I encourage younger pharmacists now to think about being healthcare professionals rather than just being medicine providers. And going forward, they will play a very, very important role in within their communities, whether it be in pharmacies, whether it be in hospitals, or whether it be in medical surgeries or nursing homes. They will play an increasingly important role, powered by digital enablement, to generate more and more quality health outcomes within our communities. So I certainly congratulate you, Rajendra, on this initiative, and FIP certainly supports 100% this declaration of responsibility. Thank you.
Thank you, Dr. Paul. And at one time I was leading the world's largest pharmacy chain in India as a CEO, and I had coined the line for pharmacists caring beyond prescriptions. And that holds so true if we have to see the future.